The Best Docs Network helps you find some of the best doctors utilizing the latest procedures and practices in healthcare. Actual patients and the doctors themselves walk you through their stories that together help you make the best decision in your search for the right doctor. On today's episode, minimally invasive spine surgeon Dr. Douglas Wan talks about an innovative surgical technique he developed called Lumini Microinvasive Surgery. My Bariatric Solutions features their mobile lap band unit to help patients with their follow-up lap band appointments. Cosmetic dentist Dr. Guy Lewis gives his patient renewed confidence with her new smile. Craniofacial and plastic surgeon Dr. David Jenikov discusses his detailed and customized approach to rhinoplasty. And doctors from Forest Park Medical Center utilizing the latest in technology and techniques.
At Lumen Health Spine Care, we developed the latest and the most innovative minimally invasive surgical technique, and it is called Lumini Microinvasive Surgery. This is utilizing the most modern technology so that we can preserve all the normal tissues in your spine without creating any kind of damage to your back and without stripping the muscles. We make extremely small incision and go between the muscle fibers with an endoscope to perform the same procedure as if we perform a traditional open back surgery. The big advantage is that the patients are not going to have significant amount of pain. They're not going to have their muscles stripped off their spine, so therefore it minimizes the bleeding, scarring, pain, so that they could recover so much faster. Patients after undergoing Lumini microinvasive surgery are discharged to home on the same day or the very next day, depending on the type of procedure they're having. And many of the patients can return back to work or their light duty activities pretty immediately after the surgery. So we evaluate the patient to see if they're candidate for Lumini microinvasive surgery by having a full consultation and evaluation. And patient may undergo imaging studies or pain mapping process by our interventional pain specialist so that we can clearly identify and accurately identify their pain generator, and so that we can perform the least invasive procedure for the patient. We developed Lumini microinvasive surgery because I personally witnessed it from my father, who had multiple open back surgery. He went through a significant amount of pain, developed chronic pain, and he had a failed back syndrome and lived 30 years of his life with significant amount of pain. And watching him suffer, I realized that we must do something better than what we're doing now to help all those patients with significant amount of back pain and chronic pain. So we used all the latest technology, worked closely with the engineers to develop the least invasive way to approach the spine.
Get at least 7 hours of sleep a night. It will help you live longer, lower your stress, sharpen your memory, and reduce cravings for fattening foods.
Before I saw Dr. Sanders, I thought I had messed up my sciatic nerve because I just couldn't get away from the pain in my hip. It put a really big damper on my whole life. I mean, it hurt to sit in the car, it hurt to sleep, it hurt to walk, it hurt to stand. It didn't matter what I did, it hurt. So I went in thinking that I just had some nerve damage or something, and he x-rayed my hip and came back and said that I was bone on bone.
At the stage that Linda's hip was at, she had really severe loss of cartilage in the joint where bone was rubbing on bone, causing extreme pain. And so really about the only viable option for her was to consider hip replacement surgery. Now there are different ways to perform hip replacement surgery. How I prefer to do the surgery is through an approach coming from the front of the hip called an anterior approach. This is an example of a hip with a more traditional posterior approach. An incision is made through the musculature here along some tendons, and then after that is released, Then we have the back of our hip. With our hip replacement coming from the backside, there are various tendons and muscles that attach to the back of the bone. And so in order to perform the surgery, we have to detach these tendons and muscles from the bone. And so if we detach those, now we can access the hip joint. With anterior approach surgery, we're able to use a natural plane or natural window through the hip just by separating these tissue planes. And after that's performed, now we have a natural window directly to the hip without cutting any muscles or tendons. This allows much less trauma to the surrounding tissues and therefore a more rapid recovery.
After the surgery, it was wonderful. I was totally out of pain. My whole life is totally different. I walked 800 feet the first day and did stairs the next day, so it was great. Before I couldn't, and now I can, so it's been wonderful.
To learn more about Forest Park Medical Center and their doctors, go to bestdocsnetwork.com. Find your doctor on bestdocsnetwork.com.
Initially, we had a lot of trouble getting patients that were from outlying areas taken care of as far as their adjustments for their bands.
When you adjust a lap band, what you're doing is you're accessing the port, which is located in your abdomen area, and you put saline in it, and it blows it up just like you would an inner tube. As the food goes into the stomach, in that, which we call the pouch, it has receptors, and with those receptors is what triggers to the brain that you're full. And by the lap band restricting and holding that food in that area, you will get a full feeling much quicker than what you would normally.
We had a fluoro machine because we do all of our adjustments with an x-ray machine, and those were extremely expensive, and I had to figure out a way to get those to the patients. At that point, we decided to put that in a mobile unit, or we call it a lap band wagon, to do adjustments for patients on site, or at least in their area.
This is where we do the actual follow-up appointments and also do the fluoroscopy on the patients to make sure that their band is working and to see how much their band may need to be adjusted.
The fluoroscopy machine is like a live video. They drink barium. It allows us to actually visualize it going down the esophagus, in through the lap band and into the stomach. This gives us an idea of how everything is working inside.
It's just as sanitary, just as sterile. We use the same procedures as if we were in the emergency room or in the office.
Because follow-ups are so important to our patients' success, we've made it possible now for all patients, regardless of the type of procedure that they've had, to be able to do their follow-ups on board the lap band wagon, which makes it beneficial for the ones in Abilene, Amarillo, Waco, the different locations that we drive to. But we are the only practice in the country that has a mobile unit, and we're really proud to have this.
Max has a question for Dr. Jason Harrison. How do I know if I have a hernia?
A hernia, by definition, is an abnormal protrusion between one or two body spaces. You can have a hernia in your brain, you can have a hernia in your thorax, and the abdominal wall hernias are usually the ones that general surgeons care for. And so anywhere there is a muscular or a fascial defect in the abdominal wall, that's a true hernia. If something that's not supposed to be there is protruding out. And you can have a hernia at your belly button, you can have a hernia in your groin. If we do an MRI, or if we treat their symptoms and they don't get better, then they are diagnosed with a sports hernia. And a sports hernia sometimes can, many times can respond to medical management alone, which we can handle here at Highlander Surgical Associates, and sometimes it requires surgery.
Ask our doctors on bestdocsnetwork.com.
After my pregnancy, I started seeing my teeth weakened with the pregnancy, and I started having some issues. My cavities were profound, and it had affected my teeth. I wanted to have, where I could smile, and I think about being embarrassed about my teeth and the way they looked.
And so she came in and she wanted to see if something could be done. And I think she was real apprehensive about, man, this is going to be really bad. And, yes, she needed some work done, but I could see, and because this is what I do, the great majority of the time, this is what my emphasis is, I knew I could fix it and make it look awesome.
I'm glad to say that, he gave me a solution, and, there's hope. We could get you that smile, no problem. And that was like the biggest relief ever.
Giselle is an example of what I see a lot. People come in, and unfortunately, a lot of them have been to dentists who have told them that there's not much hope for them, or they can't do a certain procedure, or they only give them like one option, and it's not a very good option. I think one of the advantages to coming here is that people can have hope when they've been told there's no hope, or have options when they've been told maybe they only have one choice of how a treatment can be. And so I'm confident in what I do that I can deliver a result and make it look great.
I don't have to think about it anymore. When I smile with confidence, and that's something I don't even think about. It's my smile says everything. People think I'm happier now. People think like, oh, what a happy lady, because I smile more.
So now Giselle is very happy. She's more self-confident. She's more vibrant. She just loves life, and she just exudes that. Giselle's just full of life, and she looks great, and very, very happy.
The confidence that it brings, that you get from having a good smile and having a confident smile, is invaluable. I definitely know that if you go to Dr. Lewis, he's going to give you the smile that you've always wanted.
Having a scheduled time for eating is a great way to keep your digestive system healthy. Try to sit down for breakfast, lunch, dinner, and a snack at the same time each day.
Before I had the surgery, I was pretty unhappy with my nose. It had a big bump and it kind of was wider on my face, so I knew I wanted to have it when I was probably hit high school, and so I waited till after I graduated and did it.
So Melanie had a few issues. She had a very broad nose. Both the bone structure as well as the tip were very broad, and the tip of the nose dropped a little bit, and was also undefined. So the goal for Melanie's nose was to narrow it, to narrow the tip, to raise the tip, and give her better definition, including straightening the septum internally.
When I initially came to see Dr. Jenikov, he took me in for a consultation, and he took photos of the side and the frontal view of my nose, and then he showed me on the computer what it could look like, and I was pretty happy with what he envisioned for it. Dr. Jenikov told me, it was a big decision to make, but he talked me through it, and any questions I had about pain or what it was going to look like, he answered them.
Noses are a little bit different. They require a little bit more time. So when I talk to patients about rhinoplasty, it's important for me to understand what the patient wants. The first thing I do is I sit down and talk to the patient, and I ask them what bothers them. I ask them, kind of what they think they want their nose to look like. Additionally, I ask them if they have any functional problems, breathing problems, if they ever fractured their nose. The other thing that I do, I think, which may be a little bit different, is I do computer imaging after the patient has decided they want an operation. I want to make sure that the patient sees patients of mine, their befores and afters, and kind of sees, that looks like my nose, or that looks like my nose, and I like that result.
Before I got the rhinoplasty, I was definitely self-conscious of my nose, always trying to hide it, and because it was the main focus on my face because it was wider, and after, it's definitely balanced out, and so it made me a lot more self-confident.
You notice something about Forest Park Medical Center the moment you walk through the front door. Gone are the smells, the sights, and the sounds that are typically associated with most hospitals. And in their place is something decidedly different. You see, Forest Park Medical Center was designed to be comfortable, inviting, even calming. The fact is, many of our patients don't want to leave. Come experience for yourself what medical care should be. Forest Park Medical Center, your destination to better health.
I didn't feel good about myself, and I never wanted to go anywhere. Now my world has opened up. I occasionally go out with my girlfriends, and we have a great time together.
I was getting older and didn't really care about my weight, but my doctor said I needed to do something immediately. Now I'm spending time with my grandchildren, and every moment seems special.
My one reason was to live life again.
My one reason was to simply live.
So what's your one reason?
Barker Bariatric Center. Log on or call today for your consultation.
Coming up on the second half of today's show, interventional cardiologist Dr. Annie Varghese discusses the signs and symptoms for those with an irregular heartbeat. Family medicine doctor Richard Honecker addresses common health concerns in our Medical Minute. Clinical psychologist Dr. Collins Hodges talks about the therapeutic techniques he uses to help children and adolescents. Facial plastic surgeon Dr. Yadro Ducic helps his patient improve her appearance and quality of life with a facelift, as well as more doctors from Forest Park Medical Center utilizing the latest in technology and techniques.
I was quite tired, and I travel considerably, and at that time I would go through an airport and I'd have to stop and rest, and so I realized that I needed to check in with a doctor and see what was going on.
So Mr. Richardson has cardiomyopathy, ischemic cardiomyopathy from coronary artery disease, multiple blockages that really weakened his heart over time, and that's how I found him many, many years ago, about 15 years ago.
Pretty common that you neglect yourself. You think nothing's ever going to be wrong, but I found out I had high blood pressure and I was border diabetic, and we did a CAT scan, and during that time they found out that I had an irregular heartbeat. So at that time I was told I needed to go to the emergency room, and next thing I knew, I was having a quadruple bypass.
We were able to intervene on his cardiovascular disease, coronaries, fix those, but what happened was the heart was so weak, so he ended up needing a device, which is different than a pacemaker. It's the shock box. A defibrillator is put in under the skin, and again, like the pacemaker, the wires will go to the heart, but then this box is able to protect the patient, shock them, if the heart stops, or if the heart goes into ventricular fibrillation or ventricular tachycardia.
Well, I'm able to carry on my daily work duties, and I can travel, and I'm not so sure if I hadn't had this great care that I would have been able to do that at my age. I'm going on 71 and still working every day, so I give Dr. Varghese lots of credit that she's helped me sustain a good life.
He's been able to function normally, and it has actually improved the function of his heart. He can walk around, he's not short of breath, he can take care of his thousands of employees and customers, and what a blessing that's been for him.
Request an appointment on bestdocsnetwork.com.
Let's talk about blood clots. These occur in the veins, usually of your legs. And what happens is they grow, and then pieces can break off and travel to your lung in the form of a pulmonary embolism. That can be deadly. So what causes blood clots? Immobility is one of the main things, and that means being at prolonged bed rest after surgery, or after a long flight on an airplane, you can develop blood clots. If your leg is in a cast from some injury or surgical procedure, you can get blood clots. And then again, these can break off and cause pulmonary embolisms. So what do you do to prevent them? First of all, stay mobile. If you're in an airplane for a long time, get up and walk the aisles when you can. If you're post-surgical, have the nurses and hospital staff help you get up and around as quickly as possible. There are medications you can use to thin out the blood, aspirin and even stronger drugs than that. But the main thing is to stay mobile, especially if you're prone to blood clots.
John was having a lot of shoulder pain. We had an MRI scan, and the MRI scan showed severe arthritis of his shoulder. All his cartilage had worn out. But more importantly, what it showed was that his rotator cuff was also torn. And not only was it torn, it had been torn for some time. The ball, which the shoulder is a ball and socket joint, the ball was elevated up and hitting the top part of his shoulder so it wouldn't move. In those situations, up till 10 years ago, we really didn't have too many options. But over the last 10 years ago, this new technology with reverse shoulder replacement came through, where all of a sudden you didn't have to depend on the rotator cuff muscle anymore to get movement out of the shoulder. What you ended up doing was you put the ball where the socket really is and put the socket where the ball goes. So now your shoulder moves around the ball as opposed to the ball moving in the socket. And now your deltoid muscle, which most of us have robust deltoid muscles, can move that arm and move it much better so that movement becomes possible, getting back into a lifestyle that you enjoy again, taking care of yourself, putting stuff away in the shelves again. Simple things like, going shopping again and carrying a gallon of milk into the fridge again. Surgery takes about 2 hours to do. It is an incision right in the front of the shoulder. It's about a 5-inch incision. We go down, move the muscles out of the way, get down to the ball and socket, removing the ball, putting the socket in place. You're in recovery, you're in a sling. The very first day after surgery, you start doing small, gentle exercises, and usually in a month, you're better than you were. John's doing real well. It's been 5 months since his surgery, and he's back to doing everything he enjoys. He's very happy with the results.
To learn more about Forest Park Medical Center and their doctors, go to bestdocsnetwork.com.
I think people get the differences between a psychiatrist, a psychologist, and a counselor confused. So here are some of the major differences. A psychiatrist is a medical doctor. For the most part, their practices deal essentially with prescribing and then monitoring medications. Counselors have a master's degree in psychology or a related field. Psychologists have a doctorate in psychology. So my doctorate is in clinical psychology. I've had 8 years of training in both the assessment and intervention of children and adolescents, with a specialty in the emotional and behavioral problems that they present when they come in. You distinguish adolescent therapy from adult therapy in large part on what the developmental differences are, what the developmental task is for that age group, and that is, who am I? How do I fit into this world? When parents are debating whether or not to bring their kids in for therapy, the first piece of advice that I have for them is to sit down and spend some time talking with their child about what therapy means to them. My first session is always a consultation that doesn't cost anything, and so I want to use that time to really get across what it is that I do, but really, more importantly, to get an idea of how the child perceives his or her problems and what it is he or her wants out of treatment, what are his or her goals. I think it's really important to help adolescents understand who it is that they are and how best to fit in with other people. That's what makes those crazy years from 12 to 19 or 12 to 20 so critical. And so if I can help them get a greater understanding of that, developmentally speaking, then I'm doing my job.
Brett has a question for Dr. Carol Millette. I am not having any symptoms, so why should I have a colonoscopy?
So we want to do young, healthy people who are not having trouble. If hypothetically we are to wait until someone's having a lot of symptoms, that often means that a cancer is already big, and at that point it's a lot harder to treat. The biggest risk factor for colon cancer is age. So as you get older, you're more likely to have colon polyps, you're more likely to have colon cancer. We want to find that as early as possible before you're having symptoms. With polyps, if we find them before they turn into cancer, we remove them that day, and it can literally prevent that patient from getting cancer. So when they are worried that they don't need to have this because they're not having trouble, I tell them that that is the exact right time to have a colonoscopy.
Ask our doctors on bestdocsnetwork.com.
If you want to have decent hearing when you're in your 90s, you can exercise your ears. Simply turn on some music and practice singling out a single instrument and listening to it. This exercise can help to hear more details in everyday sounds.
It's important to first determine that if they're an appropriate candidate for a facelift or not. The general principle is you have to have enough looseness of skin and redundant skin to be a good candidate for facelift. If you don't have enough looseness of skin or laxity, it just won't work very well. You have to preserve the central third of the face, so this oval, if you will, because that's really what defines us as a unique individual.
I am getting older, and teaching is my third career. And what I observed was the older looking teachers were losing their jobs. And I just wanted to look as young as I could. I had tried a variety of other things, other procedures, and I finally decided to just go for it and go to Dr. Duchik and get everything fixed up. I was impressed by his place of business, as well as his people were all very friendly and helpful, and they just made me feel comfortable. It was overall a positive experience, and I felt like he really knew what he was doing.
We have so many minimally invasive techniques available today that really have very little downtime, have excellent results, and make you look more youthful and fresher, because that's the whole point of everything. It's the point to look better. And however we can accomplish that, that's easiest on the patient, that's what we want to do.
I don't think he does things that don't need to be done. So he doesn't push more than you would need, whether that be shots or surgery or whatever. He does what he thinks is going to give you the best result. I definitely am glad I had this done. Most people have no idea how old I am, so I feel pretty good about that. Nobody's tried to fire me for being too old to teach, so I feel pretty good about that. And I'm very happy with the results, very happy.
Watch more videos on bestdocsnetwork.com. Didn't find the doctor you're looking for on today's episode? Head to our website, bestdocsnetwork.com. There you can search our video library by topic, specialty, and doctor. The Best Docs Network, helping you find the right doctor and bringing medical education to you.